Is COVID still a threat for older adults in 2025? With new variants and changing guidelines, it can feel confusing and overwhelming. But don't worry today, I'm here to help you understand exactly how COVID continues to affect seniors in the US and what you can do to stay safe and healthy. Whether you're fully vaccinated or still have questions, this video will give you clear, practical information you can trust. Let's dive in together. Hello everyone, and welcome if you're an older adult living in the United States, or if you care about someone who is, this video is just for you. We know COVID-19 isn't the breaking news it once was, but that doesn't mean the virus has gone away, especially for older adults who still face some risks. Maybe you're wondering, how does COVID still affect seniors in 2025? Are vaccines still effective? What about new variants? Should I still be careful? These are great questions, and today I'm going to share clear, easy to understand answers. We'll talk about how COVID continues to impact older adults, what has changed since the beginning of the pandemic, and what practical steps you can take to stay healthy and safe. I want this to be a friendly and helpful conversation, no medical jargon, just straightforward facts and advice. Before we jump in, if you find this video helpful, please give it a thumbs up and subscribe to our channel for regular updates tailored especially for seniors. Let's get started. Since the start of the pandemic, older adults have been among the most vulnerable groups. This is because as we age, our immune system naturally becomes less strong. That means it's harder for our bodies to fight off infections like COVID-19. Many seniors also live with other health conditions such as diabetes, heart disease, or lung problems, which can make the virus even more dangerous. Even though many people have been vaccinated and some restrictions have eased, COVID-19 hasn't disappeared. The virus is still circulating and new variants continue to emerge. One such variant you might have heard about is called XEC. These new versions of the virus can spread faster or sometimes behave differently from the original strain. Vaccines remain one of the most important tools we have to protect ourselves. They have helped millions of people avoid severe illness and hospital stays. However, vaccine recommendations have changed over time. Now, updated booster shots are available that better target the newer variants. Staying up to date with these boosters can greatly improve your protection. Besides vaccines, other simple habits are still effective. Washing your hands regularly with soap and water is a basic but powerful way to reduce your risk. Wearing masks in crowded indoor places or when COVID cases are rising in your area can also help keep you safer. Avoiding close contact with anyone who's feeling sick is another smart step. If you do happen to get sick, there are better treatments available than ever before. Doctors now can prescribe antiviral medications that, when taken early, can reduce how sick you become and help you recover faster. Knowing what treatments are available and when to seek help is very important. The pandemic hasn't just affected physical health. It's also taken a toll on mental health, especially for seniors. Many have experienced loneliness and isolation, which can affect overall well-being. Staying connected with friends and family through phone calls, video chats, or safe in-person visits is crucial for keeping spirits up. So while COVID is still a concern for older adults, the good news is that we have many ways to protect ourselves and keep living well in 2025. Understanding how COVID still affects older adults is really empowering. When you know what to expect and what steps to take, you can protect yourself better and feel more confident in your day-to-day life. Let's start with vaccines and boosters. These shots do more than just reduce the chance of catching COVID. They also help your body fight the virus if you do get infected. Staying up to date with boosters means fewer trips to the hospital and a much better chance of having mild symptoms instead of severe illness. This can make a huge difference in your quality of life. Masks are now more of a personal choice, but knowing when it's helpful to wear one can give you peace of mind. For example, wearing a mask in crowded indoor spaces or when local COVID cases are high can protect you without interfering too much with your daily activities. This way you can feel safer when you're out and about visiting family or attending events. Early treatment options are another important piece of the puzzle. If you do catch COVID, medications that fight the virus can reduce how sick you get and help you recover more quickly. Knowing about these treatments ahead of time means you can act fast and get the care you need, which is especially important for seniors. Mental health is just as vital as physical health. The isolation and worry caused by the pandemic have been hard on many people, especially older adults. Staying socially connected through phone calls, video chats, or safe visits helps reduce feelings of loneliness and keeps your mood positive. Good mental health supports your overall well-being and strengthens your immune system too. Many seniors tell me that understanding these facts and taking small, manageable steps makes them feel less anxious and more in control. It's about more than just avoiding illness. It's about living your life fully and with confidence, despite the ongoing challenges. By paying attention to what's changed in 2025, you're not just reacting, you're taking charge of your health and your happiness. And that's something truly valuable. Now that we've talked about what's different in 2025 and why it matters to you, let's focus on what you can do today to stay safe and healthy. These are simple steps you can take to protect yourself, your loved ones, and continue enjoying life. 1. Talk to your healthcare provider about boosters. One of the most important things you can do is to ask your doctor about the latest COVID booster shot. These updated boosters are designed to protect you better against the new variants circulating this year. Even if you've been fully vaccinated, before staying current with boosters helps keep your immune system strong. Don't hesitate to ask your healthcare provider for advice tailored to your health needs. 2. Practice good hand hygiene. Washing your hands regularly with soap and water remains one of the easiest and most effective ways to avoid catching many viruses, including COVID. Try to wash your hands after being in public places, before eating, and after coughing or sneezing. If soap and water aren't available, use hand sanitizer with at least 60% alcohol. 3. Use masks when appropriate. While masks may no longer be required everywhere, wearing one in crowded indoor spaces on public transportation, or when you're around people who might be sick, can greatly reduce your risk. Choose a well-fitting mask that covers your nose and mouth. It's perfectly okay to politely ask others to wear masks or keep some distance if you feel more comfortable. 4. Monitor your health daily. Pay attention to any new symptoms like cough, fever, fatigue, or difficulty breathing. If you start feeling unwell, get tested for COVID and contact your healthcare provider promptly. Early diagnosis means you can get the right treatment sooner, which is especially important for seniors or people with other medical conditions. 5. Stay informed from trusted sources. There's a lot of information out there, and not all of it is accurate. Follow trusted organizations like the Centers for Disease Control and Prevention (CDC), your local health department, or your doctor for the latest COVID updates and recommendations. Avoid spreading misinformation by double-checking facts before sharing. 6. Stay socially connected. Protecting your physical health is vital, but don't forget your emotional well-being. Stay in touch with family and friends through phone calls, video chats, or safe in-person visits. Staying connected can help reduce feelings of loneliness and boost your mood. 7. Consider your environment. Keep an eye on COVID case numbers in your area. If cases are rising, try to limit unnecessary outings or opt for safer options like online shopping or having someone you trust help with errands. Being flexible with your plans helps reduce exposure risk. 8. Have a plan for treatment. If you test positive for COVID, it's important to act quickly. Ask your doctor about antiviral medications that can help reduce the severity of illness. Having a plan in place means you can get care right away, improving your chances of a mild recovery. Remember, every person's situation is different. Some seniors might feel comfortable being more active, while others might need to take extra precautions. The key is to listen to your body, stay informed, and make decisions that feel right for you. Thank you so much for watching and taking the time to learn about COVID safety for seniors in 2025. If this video helped you, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to the channel for more health updates tailored just for you. Now, I'd love to hear from you. Have you gotten your latest COVID booster? How was your experience? What safety habits have helped you feel more comfortable this year? Do you have any tips for staying connected with loved ones safely? Please share your thoughts and stories in the comments below. Your experience might help someone else in our community. Stay safe, stay informed, and remember, you have the power to protect your health and enjoy life in 2025 and beyond. See you next time.